So just follow the questions that were asked?
Yeah.
So our task was to answer a number of questions, and I start from question number 1. I think we'll take turns so that you take question number.
Sure.
I don't know. And the question was similar to what we just discussed at our tables. What does health and health equity mean to you? And I like the definition that is used by the World Health Organization that states that health is a state of complete physical, social, and mental well-being. And I'd like to add here socioeconomic well-being, because being in poverty can really impact your health and well-being because things cost money in the world that we live. I think that when one is able to have a roof over their head, nutritious food on the table, and a sense of belonging in the community of humans, there is a good sense and a sense of health. And I also equate equity, the context of social justice and peaceful coexistence. So if there isn't violence, if there isn't the discriminatory practices, then a person can then have the same access to things regardless of their skin color, origin, gender, and a number of other topics that become barriers for some to have a healthy life.
So I already shared my perspectives on health and health equity with my table, but I like what Antonia just said around health. What I share with my table is that I really see health, if we think about a state of health, especially if we think about a state of health for an individual, it's really about having balance in your life. So it's that definition that somebody offered earlier, the balance of your physical health, your mental and spiritual health, but then also having a sense of peace, and I think that gets connected to a sense of safety. One of Amanda at our table talked about safety, and I was like, yeah, that really is part of that sense of peace is feeling safe within your community. And then I really like what Antonia said around sense of belonging. I think that is something that is really becoming more and more talked about, is a sense of what makes for a healthy community is having people feel connected to where they live and to their neighbors, but particularly where they live too. And so then when I think about health equity, I really think about the systems and the environment that in which we live. And so it's about whether or not those systems and environments are conducive to us being able to achieve that state of health. And so does the environment reflect my values, my culture, does it meet the needs that I need to access and be healthy, as far as food is concerned, as far as types of physical activity that I might be more akin to. And then, one of the things that I did in a previous job is put together a blueprint to health equity for our Asian communities. And one of the biggest factors within that was really about the health system. And just calling out the fact that the health system is a culture in and of itself. It's not even just mainstream culture, because mainstream people still don't understand the health system, right? So it's a culture of itself, and it's very inflexible, and it's created, and I'm not going to, try to be judgy in the health system, but it's not created by us. It's created by a system that's, intended to make profits, and or at least make its bottom line, for hospital systems. And so it's not really thinking about how do they really create the healthiest community, and like a nonprofit should work to put itself out of work. I don't think we're ever going to put hospitals out of work, but they should really think about how do they contribute to the communities that they're serving, so that they can really minimize those urgent care emergency room visits that they complain about that they lose money on, right? And so I'll stop there.
Go on, you're on a roll. The next question is for us to talk a little bit about the work that we do in health and how racial equity is tied into that work. I work for the Department of Human Services, and this agency has been traditionally seen as a very large bureaucracy, complex, difficult to understand, and many times the people who use the services that the agency funds or provides directly do not necessarily meet the needs, the preferences, or the wishes of those receiving those services. When I was hired, I was given a task of looking across the agency around programs that we knew or we suspected were not meeting the needs of everyone using, that there were some disparities according to certain populations. Why is it that some of the populations entered the program, graduated successfully, while others returned for more services, and even through that process, they were not benefiting, they were not becoming successful as they had hoped for. One of the things that I had learned during my working in this community, Frogtown, as managing nonprofit organizations, is that we can't do the work without the voice of the people we serve. So I was fortunate to have been exposed to the experience and bringing that into the bureaucracy to say, we cannot make these decisions or arrive at some findings here in the absence of the very people that we are talking about, because they are not here at the table to speak for themselves. There was a reluctance in going out into the community. Some people were somewhat hesitant because either they had never done it or they did not feel comfortable doing that. And it is true that the very first few meetings, the different cultural communities who came to the table that we invited, they were very frustrated, they were very irritated with the state because in their perception, the agency didn't care about them and their well-being. The agency had made certain decisions and wanted to deliver them without consulting them. And over a period of time, it took us close to 4 years to really start to build some level of trust and relationship. And it did really involve an equal exchange of learning, in which the employees that came with me, along with a senior leader, were very instrumental, especially this leader, in terms of when certain people in the group say, DHS really gets this totally wrong, or DHS doesn't understand us. And many times she would say, you could be right about it, and that's why we are here in conversation, hoping to learn how can we do this better. And that generated then a process in which we created, I say we, but it was really the collective of both state employees, which were in a smaller number always than the cultural communities, a series of recommendations for the agency to undertake, as well as recommendation that has come to fruition at this past legislative session. One of the things that they recommended is that our agency did not hire the people who looked like the people we served. So the agency changed its affirmative action goals to develop some goals for minority hire. Another concern was the fact that as an agency, we knew very little about the community we served. So they really recommended some anti-racism training, which the senior leadership went through, and they learned how much we excluded the community that we served and made some actions to make sure that we include more individuals impacted by disparities in the planning and development of the policies. The Cultural and Ethnic Communities Leadership Council was created and passed into law this past legislative session with the purpose of advising the Commissioner of Human Services on disparities reduction. It started meeting November 15th of this past year. February 15th, we had to produce a report to legislators stating to them how are we going to operate in this next 2 years, the next biennium. And there were several good recommendations that I'm going to talk about later as we answer these questions. I'm done.
So my background is in community organizing and public health. So I'm gonna share. I like my story, so I'm going to share my story with you, and I'm going to take you back to 6th grade. And so I've always been very social justice minded without even really knowing what social justice was. And when I was in the 6th grade was when, and I'll date myself a little bit here, was when Ryan White was being let back into school. How many people know who Ryan White is? Yeah, so this is how one dates oneself. It's shocking that people don't know who Ryan White is anymore, because it was such a phenomenal story of the 80s. And so Ryan White was a boy who was taken out of school because he had HIV, and or AIDS. I don't remember enough to say if he had AIDS, but he had HIV, and the courts let him back into school because they found that there was really no risk or threat to the other students. And so when I was in the 6th grade was when he was being let back into school, and parents were pulling their kids out of the school because he was going to be there, and people were outraged. And so we had your current events unit. I had a very good school. We had current events, and we were talking about this, and my teachers asked the classroom and said, who here, if Ryan White were in our classroom, would be scared of Ryan, if he was here? And everybody raised their hand except for me. And my teacher, came up to me and said, now, why didn't you raise your hand? Wouldn't you be scared? And I was like, no, because right before she asked that question, she had shared, as a part of current events, at that point, we knew how HIV was transmitted. We knew it was not transmitted via casual contact. And so I said, no, because we learned all of these things right there. And she said, trust me, if he was here, you would be scared. And so that from that moment on, I had this commitment to fight the misunderstanding and stigma of HIV. And so when I went to school and I came out of school, I ended up working with the Minnesota AIDS Project and Youth and AIDS Projects to do this education and to do the prevention. But that really is what kind of started me into the social justice world. And so anyway, so health has always been just kind of something that I've been very passionate about. Equity has been something I'm very passionate about. When I came out of college, I became a neighborhood organizer, and I organized actually here in Frogtown and Summit University neighborhoods. My very first campaign was making the city of Minneapolis make good on their new ordinance of around living wages, and the first instance where that ordinance got applied was on the Minnesota Wild's Excel Center, actually. So anyways, that's not the point here. So I did neighborhood organizing, and I learned about just a lot of equity issues and racial equity issues, neighborhood, community issues, and how disparities happen, how where we lived really affected our outcomes, whether it be income, wealth, it'd be jobs, education. So that was very powerful for me. And that, working with a bunch of progressive people, it was the first time I was exposed to this quote that talked about how it was from World War II during the Nazis, and this pastor said how, gosh, I can't remember the quote now, but it was like
They came.
Yes, thank you. They came for the Jews, and I was not Jewish, so I said nothing or something to that effect.
Yeah.
And then they came for the Catholics, they came for the gays, but I wasn't, so I didn't. And now they've come for me, and there's nobody here to help me, right? And so that has been really the passage that has just kept me committed to this larger racial equity movement. So even if it's something that doesn't affect me specifically, I understand how if it affects anybody, that we just can't move ahead. How can you let somebody else suffer and while you prosper? And so that's really been my commitment, and that's kind of how the Health Equity Working Committee came together. I was working in the Asian community, and and that's really diverse in and of itself, and so trying to get the different Asian communities to get together and work together, which we did pretty easily, because we recognized that if we didn't, we were too small as any specific community to have a voice. So we came together under this kind of generic rubric of Asian that nobody identifies with, but only in America. And so, and so we came together, and we fought, for better data that would represent who we really are. And that has grown into a much larger movement across all communities, the African community, the Latino community, Native communities. And so everybody is now about data. And so then when the state had this initiative to eliminate health disparities, it was definitely, helping communities get connected to the health system. And it may not have been an ideal way, it may not have been perfect, and there were some organizations that people were like, why do they keep getting funded? But it was still meeting its purpose. And then they changed how they did it, and it really kind of dismantled some of this kind of what we would perceive as safety net systems in our communities to get connected to resources. And so, me working for the Asian Coalition connected with my friends over in the African American community and said, hey, this new funding process has defunded all of our organizations. We, what's going on with you? Is anybody in your community getting funded? They said no, and then called, people in the Latino community and the Native community, and we all were like, no, none of our communities are getting funded. And so we came together to really kind of find out what do we know about this new funding, who got funded, what was the process. And then with then Representative Hayden, we held a huge hearing where we had over 200 people from our communities come and testify and listen to the Department of Health defend itself and its decisions to change how they were eliminating health disparities and be drilled on how they were not being accountable to communities in these changes. And so the community felt a lot of power in this and coming together across our racial ethnic communities, and then said we really need to get more of our communities involved in this, and so we engaged our grassroots communities to get more involved, and that's how we started doing what we call Health Equity Day at the Capitol every year, to engage our communities, get involved and have a voice and take their stake that they have in equity and racial equity in health here in Minnesota. And we're having our 4th Health Equity Day on I'll have this out on April 4th. But, and so that's kind of how it all started. Yeah.
Our third question is talking about the greatest assets of communities of color and building a movement toward greater racial and health equity in the Twin Cities. Do they have the question?
No, they don't.
Okay. So it's okay for me to read them. And how is our work poised to capitalize on those assets? As I mentioned to you, when I first started working for this state agency, I was concerned by the fact that we were talking about people who are not at the table to speak for themselves. And my story is different from Joo Hee, but I was born in Brazil. I was born in poverty, and I was a dark black child, which in a country in which classism and racism are really intertwined, that's really double jeopardy, and besides being a girl. So I did live through the marginalization, the fact that my mother was a very young widow, but one who had a very strong conviction that we were poor but not destitute, and that we as children would grow up in poverty, but she would not die in poverty. And that really came to fruition by the fact that we were all educated and were able to care for her. So the greatest assets that I find in communities of color, and generally in any community, is the fact that there is so much wisdom within these communities that I believe that the culture has a tremendous impact on the healing of communities. We need to see in each individual the fullness of their humanity. And I also believe that because we don't usually stop to listen to conversations or what the people in their own cultural groups are thinking, what they value as important, what they know about themselves, and what heals them. We are missing unique opportunities in which they could align with ourselves and really meet the, I think, the directive of a health system that needs to be more efficient, more cost-effective, and all that. I think that part of my work when I was in the community, this first group, was really to listen in what they had to say about their own sense of selves. And these are some of their comments: that we thrive in our cultural and traditional knowledge of health. It resides in the wisdom of our communities. We are engaged in solving our own problems, and we welcome an inter-ethnic dialogue. We value our diversity and all its ambiguity. We are holistic at the systemic and policy level. Social determinants of health, where we live, work, play, study, and worship, matter. We engage in open, honest communication. We suspend doubts and fears, and we really listen. And I think that a major portion of my work has been in helping my colleagues at the state, as well as myself, to discipline in a listening rather than speaking all the time. I remember an old proverb. It says there is a reason why you have 2 ears and 1 mouth, and I think that is so true. So what I have been doing is really, when I say listening, some people look at me and we don't quite get it because we are not a community in a culture that spends a whole lot of time in listening and reflecting and exchanging ideas. But the way that I help them understand is, my understanding is that when we are listening, we are honoring and respecting everyone as they want to partner in their own healing. And a couple of examples that we have introduced at the department. We had about a year ago concern that continues to be a concern for the state of Minnesota in the status of children with autism in the Somali community. And for a while, we were listening to a lot of the headlines or some advocates, some who were louder than others. But when there was an invitation or there was a mention in an email message, which was a mass emailing, stating that I wish you could see what challenges these parents face with their children when they're trying to seek resources. And my suggestion was, I think we should accept her invitation and ask her, can you organize a group of parents? And I think you'd say community organizing. And we are going to go and ask, tell us about the challenges that you're facing. And we spent 2 hours with some folks from DHS who dug their heels and didn't quite think that it would be worth it. But at the end, and I have always found this to be true, that when we spent that time and person after person after person told of their stories about a child who may have been identified at age 3 and is now a 9-year-old still waiting for services, or some providers who, because they didn't speak the language, they couldn't accept the referral for their children, and so on and so forth. So what has resulted a year later is that initially a Somali person from that community was hired to help develop some action plans to take stock of all of these concerns that had been voiced, and I was taking notes. And the latest news that I have received is that a person from that community has been hired to help implement the action plan, which for me is critical, because then we know that the services to this community are going to be more appropriate than what we at DHS could ever hope to do. And more recently, we have helped define culturally specific chemical health treatment programs. And in my effort to bring the voice of community where I work, which is a very large organization, couple of occasions I have had the good fortune of bringing the voice of the community into policy. And I think if we ever get to the point in which all our policy is developed with the person impacted in mind, we are going to be in a much better place. Done.
Yeah. And I think it's so fantastic to have Antonia at DHS because she is just such a champion, an internal person to connect with, to understand how the culture works, who to talk to, and just to help us navigate and message what we see as, barriers to the disparity reduction happening at DHS. And so I just want to say it's just phenomenal, and I just admire and want to offer my praise for the work that you've been doing.
Thank you. As you know, lots to be done.
There's lots to be done. And so the question is around the greatest assets of our communities and how we're poised to capitalize upon them. And, one of the areas that I've had some training and experience in is in community-based participatory research. And in community-based participatory research, it's all about the communities defining the research question, defining the problem, defining the question, defining the methods, really taking a leadership in the research, and then taking the information gathered, analyzing it, and offering the recommendations. It's really all about the community owning that information so that it is comes back to something tangible and useful to the community to use. And so one of the things that I've just always really questioned is, so the state and however many agencies and institutions keep asking, how do we solve these racial disparities? How do we solve these problems? But then they go back into their institutions and create, and not, this is not you because your committee is all as community, but then they go back into their institutions and think about it and do their own little think tank within their institutions. And it's like, the answer is in the community. And I apologize, I'm talking so loud, I'm just a loud talker. So the other kind of enigma that's out there for me is around coalition building too, and so I'm involved with this Leadership Institute, and I don't know if people want to be called out or not, but that's one person in here is involved with too, and so it's this Leadership Institute for communities of color and LGBTQ communities to develop their sense of leadership and learn about policy and how policy is done, right? So that we can someday make policy, And but we're part of this larger coalition, and these larger mainstream coalitions, they equity is the word of the day, so they talk about equity, right? We are all about racial, ethnic, or equity, and we're going to advance it with this tax. And, and we're just like, but tax, like sales tax, it was a similar, I just don't want to call out people, but it's something similar to a sales tax. And, and we know that sales taxes are like the most regressive taxes, right? And then we also knew that what was being taxed was most heavily used within our communities of color and LGBTQ communities. And so we were like, but we're going to be paying most of this. And then there's no programs out there to help us move away from this, from this issue. And if anybody watched what happened with taxes last year, you know what I'm talking about. Anyways, and so I might be off track here, but we as communities, like there's so much readiness, so much passion, so much desire to be out there leading policy, making the changes that we want to see happen that will benefit our communities, to create and advance the equity that is needed and necessary. But we're never given the opportunity to do that. And not to say that, it's that kind of that, it's about words, and so it's like given opportunity while you just take the opportunity. But, I think that the system and structures and institutions are really intimidating. And, and so and the people that are there, whether they're supposed to be your friend or not, are extraordinarily intimidating. And so, you go to your lobby day on an issue that's all about you, but then you're just tokenized and you had nothing to do with that day, right? And so what's so fantastic about the health equity working committee is that we are a committee that's led by our communities, and we have a lot of allies that are involved with it. But in the end, the decisions come down to our communities, and the allies are there to offer support. And so I was going somewhere with that. Oh, and so, last year when we offered not a counter bill, but kind of a complementary bill to this tax. And we wanted to see, to bring about some equity to that tax that would bring some of those resources collected through this tax back into our communities to create some benefits that would help us reduce the impact of that tax on us. And so we created a bill, and what was, when we talk about assets and being poised to implement those assets, what was so phenomenal about doing this bill last year was none of us ever did a bill before. None of us led that. We had no idea how to get a bill written. We thought, you have to have a lobbyist to do that, but then Senator Hayden was really fantastic and helped us walk through it, and Senator Dibble also were really fantastic and helped us get connected to the reviser and all that. And then what was even more, and it always makes me want to cry, was that then we did these legislative visits. And all these communities, from our Latino communities, from our African communities, from our Asian communities, came to the Capitol to do these legislative visits. And most of them had never even been on the Capitol campus, let alone inside the Capitol, let alone meeting with a legislator. And we went in and we had the most phenomenal visits with our legislators to advocate for this bill. And, that when we came out of those visits, those people who had never been there before felt so empowered that they wanted to do the next visit, and they told their story. I don't know if you've ever been on a day at the Hill where they say, tell your story, and you're just like, I don't even understand the policy and the bill that we're doing, so I don't know how to tell my story that goes with it. And you just feel totally tokenized. And they wanted to tell their stories. They told their stories, and it was powerful. And then they took the bill, and one of the people who had never been to the Capitol before, took the bill and talked to one of the representatives and asked her to sign that bill. And this is the second time at the Capitol, And so it was just the most powerful, most moving, most exciting thing I'd ever been a part of, really. And so we're going to continue this work, and and it's just, there is power, there is desire, there is passion. It's just a matter of us taking that, those opportunities to do it, because maybe it is all about wording and that we've been waiting for somebody to give it to us. I don't know, but we took it last year and we got a little bit in trouble over it, but who cares, So.
And that was really a very impressive process.
Oh, thank you.
I was on the sidelines, as a state employee. I couldn't. It was. And I couldn't agree with you more in terms of how can we make sure that the voices of communities are at the table, that they are at the state capitol. As an immigrant, I'm still very enamored that democracy is so real here, and that if we don't practice it, and if we don't take it on our own hands, that somebody else is taking, and that's not what a true democracy is. Our last question was some action steps for everyone in the room to take to incorporate health equity into their work. I'm not very fond of formulas, say you do 1, 2, and 3 and you'll be fine, because I don't think that exists. I think each one of us are going to define for ourselves what feels just, what feels fair, and what is it that we determine to be our dreams and our aspirations. But I'd like to share with you the conclusion of their work with the community. They gave DHS 5 key, what we'd call, ways to use strategic lenses in order for achieving equity. And this is not on an individual basis, but a recommendation to a large institution
anytime you're thinking about developing a policy, a program, make sure that you're looking through these practices. Conduct research and evaluation, not necessarily the form research, but where has this idea had success among people of color? Where did it work? And are there models that we should look at in order to see how can they be replicated in the state of Minnesota? Partner to educate about disparities. There is a clear understanding out there that we don't know exactly what this word means or how it impacts our lives, that there is need for more education and more conversations about it so that better informed we can really come up with what might be solutions. They advise DHS to reform policies that perpetuate disparities, because we know that some laws sometimes collude with one another, and they do cause more harm than benefit to some individuals in the community. For example, because we had a large group of people from different disciplines, several county workers presented this as a fact that, for example, if a woman is in a domestic violence situation, and she needs to go to a shelter, and the shelter may not be able to accept her children. So the children are placed. When she's ready to leave the domestic shelter, she needs housing. She cannot qualify for housing unless she is a family. She cannot get her children until she has housing. So these are two policies that when you try to implement them, they get in the way of mother getting that safety and that space for her family to be reunited again. Another one was implement funding reform and transparency. They understand that we are using public dollars, but that sometimes that information is not out there. There were questions, how does DHS spend its dollars? Where is money being invested in disparities reduction? And what outcomes are you achieving with those? And lastly, but not the least important, ensure accountability. So a system of checks and balances. Is the state receiving the same return on the dollars from taxpayers that are being spent? And if they are not, what is the state agency doing about it? There were things that they also would like for the agency to look at: early intervention and prevention, going in the so-called upstream before some things becomes a crisis. How can we invest in dollars to prevent that? Work across several systems, both public and private, in a holistic way. And the word holistic comes very often in community discussion. Review and remove policies, and I talked about that, maintain disparities. Engage in flexible modes of involvement. How you invite us to the table. Make sure that you're flexible enough so that we can understand what you're talking about, that you're not using jargons that make it difficult for us to understand the conversation. And they ended with explain and educate everyone. So these are not necessarily my set of recommendations, but ones that I heard over the years that I worked with a group of very wonderful, dedicated people.
Antonia?
Yes.
So, are those one of your? Yeah. Oh. Joo Hee, and we'll go to Q&A. One last stuff.
I'll be quick, Marcia. And so, I think, I think that those are very practical steps. And I'll just say two things. One is that it's really always thinking about whatever the policy, whatever the program, whatever the process you're putting in place, just always think about how does it, how is it adaptive, flexible, available, accessible to the communities that you're trying to serve, and also try to think about those indirect impacts too. So you're having it in a school or a church. How does that really? It might be good for some communities, but then maybe there's an indirect outcome that or consequence that may be inhibitive to others, right? And so I'm just always thinking about those type of things, the direct and indirect consequences of your decisions and processes and policies and things. The other thing that I wanted to say is I just want to promote Health Equity Day, if that's okay. So Health Equity Day this year is going to be April 4th. It's a Friday. It's at the Capitol. And there's two parts to it. The earlier part will be an educational portion where we talk about, our racial equity work, finding kind of some commonalities across it, and then taking it to the Capitol for a rally in the afternoon at 1 o'clock. And the theme of this year is advancing health equity in Minnesota. It's taken from the title of the report that was just released by the Department of Health. That is really, really super progressive. If anybody has not taken the time to take a look at it, maybe it can be, a link to it can be sent out to people. But what is so phenomenal and what people are excited about is that, one, is that it actually names structural racism as one of the major factors that are perpetuating racial inequities or health inequities here in the state. The other thing that we as the Health Equity Working Committee are really picking up on is the fact that it says that it's not just the work of the Department of Health to eliminate health disparities. It has to be across agencies and departments, and we added that, and not to say that the Department of Health didn't think of this because they're just talking about the state, but we added, that it also has to be at all levels of government too. Because if the state has it, but then as the money or programming trickles down to the county or city, and if they don't have those values too, then it still doesn't help us. And so, the Health Equity Day is really going to be taking the opportunity to make sure legislators are aware of this report, to not let structural racism get swept under the rug of Minnesota niceness and non-confrontation, and to bring our different racial equity movements together to really see the commonality of equity and how can we possibly work together to support each other's work around, employment, transit, economic equity issues, including health. So I'll pass this out. And
Thank you.